We're in the middle of a pandemic. People are very stressed out, obviously. Are men having more symptoms of erectile dysfunction? And how is it affecting sex drive?
Yeah, I'm seeing more guys coming in with erectile dysfunction related to stress. The pandemic is an incredibly stressful situation, and stress affects our ability to perform sexually. And stress can wipe out the desire for sex, but even if you want to have sex, stress can kill your erection. And here's why. We deal with stress by releasing adrenaline into our bloodstream. And in prehistoric times, this was a survival mechanism that would allow us to survive a real world stress like a predator. See, adrenaline shunts blood from the less important body parts to the more important body parts like the heart, lungs, and brain. And it shunts it away from the less important body parts like the fingers, toes, and the penis. So, under the current condition of stress, the stress of the pandemic, our body is still releasing the same adrenaline that it would release if we were being attacked by a saber-toothed tiger. But in this case, we're just trying to be intimate. And that stress causes the shunting of blood away from our penis, making it hard to either get the erection or keep the erection. And then from there, it can get even worse, because what can happen is, say you had some stress, it killed your erection, and then the next time you go to have sex, the thought pops into your head, geez, I wonder if I'm going to have the same trouble having sex this time that I did the last time. And that thought, that simple thought, causes your body to release adrenaline again.
That's right.
And then you have the same problem. And then the third time and the fourth time, and it can become a vicious circle.
You become stressed. You become stressed about whether or not the stress is going to have the impact again.
Exactly. Yeah. And it becomes this vicious loop. But, fortunately, there are remedies for this. Just hearing this information on the show today can help some men take it down a notch, because now they realize they're not somehow terribly flawed or broken. It's a simple explanation, and there's an aha moment. And I see that a lot with a lot of my patients. But for others, it's not so easy, and talking to a behavioral therapist can really go a long way. But for some men, prescription medications prescribed responsibly really can do the trick, because just as adrenaline decreases the blood flow to the penis, these pills increase the blood flow to the penis and can overpower the adrenaline effect. And for many guys, it may just be a temporary course of treatment, giving them that positive reinforcement, taking that stress away each time they're up to bat, and then they can stop the medications and resume sex without that vicious loop in their head, worrying and wondering. So stress is a real physical phenomenon on the penis. It starts in your head, but it's not just in your head. But fortunately, it can be reversed.
Well, Dr. Aaron Spitz, we have to leave it there. Thanks for joining us today.
Thank you.
All right.